We're Team 9, and I'm Danielle.
I'm Ryan.
I'm Maddie.
I'm Elena.
My name is Valentine.
I'm William.
And today we're discussing pharmacist's role in home care.
Mary is a 70-year-old woman with osteomyelitis of the left foot who is referred to your home care service for continuation of intravenous antibiotic therapy upon discharge from a local hospital. Her physician has prescribed cefazolin 2 grams every 8 hours for 4 weeks. Mary received her first 3 doses of cefazolin prior to discharge, although the nurse had a difficult time establishing a peripheral IV line. In addition to her infection, Mary has a history of hypertension, insulin-dependent diabetes, osteoarthritis, and an allergy to oxycodone.
The case manager states that Mary is scheduled to leave the hospital today. She lives alone, but her daughter is willing to help, and she can visit her mother each day after work. Her insurance plan is a health maintenance organization, HMO, that has contracted with your service in the past. This HMO expects the home care provider to service Mary in the least expensive way. Your company's sales representative is excited because he's been trying to get business from this case manager for the past month.
This case represents a typical home infusion therapy scenario. Just because a patient is receiving an intravenous medication, he or she does not necessarily require hospitalization. Home care is typically more desirable and cost-effective than hospitalization for a patient such as Mary being treated for osteomyelitis. However, patients must be carefully evaluated to make sure that they can be safely treated at home.
It is also important that her intravenous access site be well established prior to discharge to avoid complications once she is home. The fact that she received her first 3 doses of cefazolin in the hospital without a problem reduces the concern of serious allergic reaction to the medication. At this time, Mary does not have any medical issues that would preclude her from home intravenous therapy, but she does live alone. Given her age, it is important that she has a support system such as a daughter who can assist her with her therapy.
Social services can help Mary and her daughter with the transition from hospital to home care. While a home care nurse can assist with some aspects of Mary's therapy, she and/or her daughter will have to be trained to administer most of the cefazolin doses as well as to care for the intravenous access site. Although a once-daily intravenous antibiotic is ideal for home care use, cefazolin every 8 hours is appropriate and is commonly used in this setting. In addition to nursing and pharmacy services, Mary may require physical therapy as well.
Types of home care services that are available are nursing services, hospice services, speech and physical therapy, social services, and homemaker services. Types of infusion therapies that are administered in the home are nutrition, anti-infective therapy, pain management therapy, chemotherapy, biologics and related plasma derivative therapies, and miscellaneous therapies.
Because of her age, Mary is a Medicare beneficiary, but she also has additional coverage through an HMO. Since Medicare Part B doesn't reimburse for home intravenous antibiotics, this is an important consideration since the HMO will most likely cover cost of antibiotic therapy. Third-party payers generally require that a home care provider is accredited by an accrediting organization such as the Joint Commission for it to be eligible for reimbursement. Since the HMO is concerned about costs, Mary's antibiotic and related supplies would be delivered to her on a schedule that is consistent with the extended stability of the drug, for example, every 7 days. In addition, the antibiotic will most likely be administered by gravity and not a high-tech infusion device, since it's not necessary in this case. Since the reimbursement for Mary's home care services under Medicare is determined prospectively, it is important that the home care provider not incur any additional costs such as extra deliveries or nursing visits, since they will not be covered.
The pharmacist also plays a large role in managing Mary's care. In addition to working with nursing personnel to assess Mary's suitability for home intravenous administration, the pharmacist also evaluates the medication for appropriateness based on her condition and other medications she is taking, and helps develop a care plan to determine desired therapeutic outcomes. An example of this would be the resolution of the infection. Also, the pharmacist monitors parameters through lab values, vital signs, and possible adverse reactions to cefazolin. Based on the stability of the compounded product, the pharmacist determines an appropriate delivery schedule to Mary's home. The pharmacist will also communicate any issues regarding her therapy, for example, abnormal lab values or adverse reactions, to Mary's physician, and make any suggestions to modify her regime as appropriate.
As can be seen, pharmacists working in home care may do so throughout a variety of settings. In all home care organizations, the pharmacist must act as a vital member of a healthcare team that cares for the patient. The team members collaborate and work together to develop a care plan that will achieve the desired outcome for the patient's therapy. The pharmacist plays an important role in establishing and monitoring parameters such as serum drug levels and blood chemistries.
This is presented to you by Team 9.